Whether you can see it or not, many of our options and choices are not set by us. They're set at various levels of government, local, state, or federal. This is especially true in healthcare. The cost, quality, and accessibility of healthcare is different based on where you live and what situation you're in. Chronic disease patients interact with the healthcare system in a variety of ways, and we're often left wondering how we can improve it. Policymaking might seem like it's just for elected officials or lobbyists, but in reality, we need chronic disease patients at every table where decisions impacting their care are going to be made. My name's Nathaniel Brown, and I'm the Director of Advocacy for the Chronic Disease Coalition. We've been fighting for the rights of chronic disease patients since 2015 in state capitals and Congress. The fact is that the legislative process isn't always designed to incorporate the patient perspective, and that's why our coalition exists. We're here to stand up for patients, but also to teach patients, their friends, and their families to stand up for themselves. There are so many ways to do that. We're going to start with the easiest. Whether you're new to the idea of talking to lawmakers, or you just don't have a ton of time or energy to do that, there are easy ways to get started. All you need to do is tell your story or sign your name.
Normally, when I tell a story, I always, Nathaniel said, I always tie it into what the law or bill is being passed. I would always go a little personal, so like this is how my disease affects my life as a patient, how this law improved my well-being or my health outcome in the future. One thing I have told is that whenever I do the lupus research bills, I would say is I always tie in as like I'm a younger patient. We're not always represented well in disease clinical trials, which is why we advocate for funding. Some more trials can be done for patients and marginalized groups for clinical testing. So that's one way I would say maybe go about it.
For patients like Anna, who are navigating their disease on top of school, work, family obligations, or social gatherings, it's important to find easy ways to make meaningful connection with policymakers. And this is, in fact, the patient superpower, because patients can do something more than what an industry insider in DC can. They can tell their story.
Yeah, I would just say for me, Amanda and Emma. So let me tell you about that. I had a meeting in January with Amanda, a mom, and Emma, a young child that was dealing with seizures, and they were working on seizure safe schools and House Bill 1085. I met with them in January. They filed up with emails. We communicated throughout session. They were informed working with the tools that organizations provide. They knew what we call cutoff, when bills were approaching deadlines, that if they didn't continue on, and they advocated at every step of the way. I mean, it was certainly good policy and legislation. But every time I thought about a vote out of committee or off the floor, it was Emma and her mom talking about what Emma dealt with in school. The stories matter, and those meetings really do make a difference.
Stories stick to our hearts, and they're memorable and human-scaled and important. But just because it's important doesn't mean you have a lot of time to tell it. Lawmakers are human too, and they're very busy humans. So we boiled down the essential elements of the patient story into what we jokingly call the Mad Libs patient story. For example, my name is Nathaniel, and I'm here to talk to you about prior authorization. I have osteoarthritis, and I have to go through prior authorization all the time for basic follow-up care. In addition to the irritation of having to talk to my insurance company, time lost from work, and the time my doctor spends advocating for me, it's completely unnecessary for standard care plans for common diseases like mine. We need the state of Washington to make this easier for patients. Once you have your story ready to tell, then what? There's no better place to start than our website, www.chronicdiseasecoalition.org. Right on our homepage, you'll find a map of the United States showing our policy priorities in your state. Let's say you live in California. You were diagnosed with diabetes 10 years ago, and you've spent the past decade navigating treatment, insurance, and juggling everyday responsibilities. But you know that they could change the rules and make it easier for diabetics like you, and you at least want to raise your hand. Click on California. You'll see a list of bills that the CDC is working on in Sacramento. There's one, Senate Bill 873, that would force pharmacy benefit managers to pass the savings they negotiate onto patients like you. If you want, you can click on the bill number, which will take you over to the Legislative Assembly homepage where all the bill information is kept. What it means, where it's at in the process, opportunities to testify, who's sponsoring the bill, etc. And if you go back to the policy map, you'll find a button at the bottom that says Take Action. This will direct you straight to our Action Center, where you can find several opportunities to make your voice heard from your couch. We don't have online calls to action on all of our priority bills, but we do have an opportunity for you to voice your support on Senate Bill 873 in California. This page will tell you all about the bill, and if you plug in your address, it will automatically send a message to your specific elected representatives with a message of support. We highly encourage you to share your story in this space. While it's not necessary to customize it, legislators will certainly take more notice if you share some personal experiences in the email. You can even use the Mad Libs. Hit send and you're done. Another way to share your story in a more energy-mindful way is a good old-fashioned email. Again, here's where your story can come in handy. To find your elected officials, you can start by visiting your state's legislative website. Let's say you live in Oregon, like I do. You can search Oregon Legislature, and it'll take you to the homepage. Click Get Involved, and then click Find My Legislator. Plug in your address, and you'll get a list of your senators and representatives, and their individual pages usually have phone numbers and email addresses that you can access. If you're having trouble finding who represents you, chances are we have their contact information, so reach out to us anytime at joinus@chronicdiseasecoalition.org and ask me about it. Back on the CDC website, you can read background information on each of our priority issues and see what other patients are saying about them. Feel free to download or share these. There are also petitions you can sign, which we deliver to elected officials at various points in the legislative process. This is an easy way to add your voice to the conversation. We don't share your name or your contact info with elected officials. We simply point to the number of people that are with us on any given issue. There are other ways. If you want to share your perspective more broadly, that's great. One way is to send a letter to the editor. This lets elected officials know where you stand and also helps other members of the public understand the importance of the issue. We also have a tool called a story bank, where you can go onto our website and tell us a little bit more about your situation and why you want to be an advocate. Simply put your first and last name in, your email, what state you're in, and whether you're a patient, caregiver, friend or family member, or something else. You can tell us a little bit about your chronic disease and how it's impacted your life. You can talk about the policy issues that you have experience with, and anything else you'd like to share with the CDC staff. You can also follow and engage with us on social media at Chronic Rights on Facebook, LinkedIn, Twitter, and Instagram. We share content every day aimed at amplifying the patient experience on our priority issues. The latest healthcare news, industry reports, calls to action, and other things are always relevant for our audience. If you want your story shared on these platforms, we can help. Thank you for taking the time to watch this quick video. Sharing your story and practicing sharing your story is something that even the most experienced advocates need to do from time to time. In future Chronic Universities, we'll be diving into best practices for engaging with policymakers, amplifying your message, and developing an advocacy strategy. For now, write down your story, practice it, and share it, and then take action on our website. At the CDC, we like to say, don't fight alone. And if you take nothing else away from this session, know that we're here for you whenever you're ready to begin your advocacy journey.